Member for Richmond South Centre.
Thank you, Honourable Speaker. First of all, I want to express my sincere condolence to everyone who has lost a loved one to this unfortunate toxic drug crisis. I cannot imagine the pain British Columbians have to endure when one of us lost a loved one so suddenly, so prematurely, and so heartbreakingly. Approximately 14,000 British Columbians have lost their lives. The unregulated illicit drug supply is now the leading cause of death in British Columbia for people between age 10 to 59, accounting for more deaths than homicides, suicides, accidents, natural disasters combined. Toxic drugs are contaminated by growing and unpredictable mixture of dangerous substances, including synthetic opiates like fentanyl, benzodiazepine, silencing, and other adulterants. The lives we are trying to save are our brothers, sisters, fathers, family members, neighbors, and other community members. Saving their life must be a top priority, and it's our top priority of our government, because every life matters. The toxic drug crisis and the event that followed for the past few years are undoubtedly some of the most challenging time for this province has ever faced. Even as BC makes progress in recovering from COVID-19 emergencies, the increased drug toxicity that come with it continue to worsen. While social and climate-related emergencies create significant challenges, of all which are impacting individuals' mental health, substance use for every age of our population. Addictions and mental health concerns are health care issues, not criminal ones, and our government utilizes scientific and evidence-based strategies to keep British Columbians' loved ones alive. In the hope of saving lives, our government is urgently working to build a seamless system of mental health and addiction care, expanding treatment and recovery services and life-saving harm reduction, strengthening prevention and early intervention, and breaking down the shame and fear that keeps people from seeking help. We have invested in hundreds of units of complex care housing. Our government has invested a historical $1 billion to build an integrated and seamless system of mental health addiction care that people need and deserves, including $586 million for treatment and recovery across British Columbia. Since 2017, the province has implemented 360 newly public-funded treatment beds. Our government has been expanding our other treatment and recovery services, which span a range of options, such as outreach programs, community counseling, day treatment, withdrawal management, harm reduction services, as well as residential treatment, bed-based services, medical assistant treatment, and more. Although treatment is vitally important for individuals' recovery, if our life is lost prematurely, all hope is lost. That's why our government places great emphasis on saving lives in our communities. That's why the province is committed to working with a range of organizations on the front of this devastating crisis. Every life matters, and we are fighting to keep people alive, combat social stigmatization, discrimination, and fear created to irresponsible confusion and conflation of homelessness, crime, mental health, and/or addiction. British Columbia must work together to address stigmatization and keep our loved one alive. I want to be absolutely clear that everyone in the chamber is against illicit drug trafficking in all forms. The contract between Vancouver Coastal Health and DUL was explicit and exclusively for drug checking, overdose prevention, and harm reduction services, critical services to keep our loved one alive and help people stay safe. The contract was terminated when we learned and confirmed DULF transactions on the illicit market. The contract is in no way, shape, or form was designed to fund the purchase of illegal drugs. The government fully expects that the contract is awarded for specific purposes, in this case to save lives and prevent overdoses. The police are now conducting and have conducted an investigation that has led to the arrest warrant for individuals. Those who break the law are held accountable, and that's exactly what is happening. The Ministry of Mental Health also sent a letter to all the peer-led organizations providing vital services in BC, working hard to keep British Columbians' loved one alive during this unrelenting crisis, reminding them that it is the Ministry's expectation that partner organizations follow the law. While our government is continuously finding ways to keep British Columbia alive, we also work hard to strengthen our community safety in our community, like Bill 34, that's restricting public consumption of the Substance Act, that is designed to complement our government's decriminalization effort to address harm reduction and also while strengthening our community safety. There's much more work to do, and I know the member mentioned about addiction, so I also want to welcome the member in the future that if ever motion around sugar and alcohol addiction issues, I will welcome the member to join us as well.
Thank you, Member.